Hello everyone. Today we will discuss about the mycetoma, which comes under the subcutaneous mycosis. So let's have a look at the subcutaneous mycosis, the infections which come under the subcutaneous mycosis. First one we have the mycetoma, which we will discuss today in detail. The second one is sporotrichosis. Sporotrichosis is also known as the rose gardener's disease. Rose gardener's disease or sporotrichosis, it is caused by Sporothrix shanki. ठीक है, mycetoma and sporotrichosis. Third, we have the chromoblastomycosis, then phaeohyphomycosis, rhinosporidiosis. It is caused by Rhinosporidium seaveri. So under subcutaneous infections, we have mycetoma, sporotrichosis, also known as the rose gardener's disease, chromoblastomycosis, phaeohyphomycosis, and rhinosporidiosis. So today we will discuss in detail about the mycetoma, very important topic for NEET PG and INICET examination. So let's start with the mycetoma. So what is mycetoma? It is a chronic, slowly progressive granulomatous infection of skin and subcutaneous tissue. बहुत ही chronic infection है, बहुत ही धीरे धीरे progress करता है, and it is a type of granulomatous infection of skin and subcutaneous tissue. ये skin को भी affect करेगा और साथ ही साथ उसके नीचे subcutaneous tissue को भी affect करता है. So mycetoma is a chronic, slowly progressive granulomatous infection of skin and subcutaneous tissue. And this mycetoma is also known as the Maduramycosis. It is known as the Maduramycosis, Madura word which comes from the Madurai, which is in South India. So it was first discovered in the Madurai in South India, hence it is named as the Maduramycosis. And also it is known as the Madura foot. Now why it is known as the Madura foot, not Madura hands or Madura trunk or Madura head? Because feet are the most commonly part affected in mycetoma. Most commonly affected parts in mycetoma are feet. Hence, it is also known as the Madura foot. Now, let's discuss about the types of mycetoma. Mycetoma is mainly of two types. First is Eumycetoma, and the second is Actinomycetoma. So, in case of Eumycetoma, this Eumycetoma is caused by fungus. It is caused by fungal agents. And these fungal agents produces black colored granules. So Eumycetoma is caused by fungal agents and they are responsible for the formation of the black color granules. Now what are the fungal agents? It is Madura mycetomatis, Madura grici, Pseudolisteria boydii, Aspergillus nidolens. Among these four, the first two, Madura mycetomatis and Madura grici, are responsible for the formation of black granules. And the other two are responsible for the formation of white granules. Now in Eumycetoma, the black or white granules are observed and it is caused by fungus. So these are the agents. Among these agents, the first two causes the black granules and other two are responsible for the formation of the white granules. Now in case of Actinomycetoma, it is not caused by fungus. We are reading it under the mycetoma, that is subcutaneous mycosis, but Actinomycetoma, type of mycetoma, which is Actinomycetoma, it is caused by bacterial agents. and it is responsible for the formation of white colored granules. Now in Eumycetoma, the black or white color granules are formed, but majority of them are black color granules. White color granules can also be found in Eumycetoma, but majority of them will be of black color granules will be found in Eumycetoma. But in case of Actinomycetoma, only white color granules are present, which are produced by bacterial agents. Now the two types of bacterial agents, first one is Nocardia species and second one is Actinomycetoma maduri, are responsible for the Actinomycetoma. Now this image is of Mycetoma of foot. Also known as the Madura foot. Now foot are the most commonly affected part as we know. Hence, as you can see the Mycetoma of foot in this image. Now let's come to the pathogenesis. These bacterial or fungal agents in Mycetoma enter the skin through soil or by accidental trauma. Now, accidental trauma like thorn pick injury or splinter injury. After entering into the skin, they will be they initially will form microabscesses, and these microabscesses are transformed into the chronic granulomatous tissue. So first these agents will enter to the skin through the soil or by accidental trauma like thorn pick injury or splinter injury, and on skin they will initially form the microabscesses. Initially they will form the microabscesses and which will later on transform into the chronic granulomatous tissue. Now if we talk about the clinical features, then we will observe the triad of symptoms in this. There are triad of symptoms present in the mycetoma. The first symptoms which will be observed are the painless subcutaneous swellings. There will be no pain on the swelling. It is painless. Second one is discharging sinuses. And the third is the discharging sinuses will contain the granules. These granules can be either black or white. Mainly the black granules are observed in case of Eumycetoma and white granules are observed in case of Actinomycetoma. Now if we look at the triad of symptoms in each type of mycetoma, how will they look at each type of mycetoma? Now in case of Eumycetoma, the triad of symptoms will appear as first the painless subcutaneous swellings will be present in both of the mycetoma, but in case of Eumycetoma, these painless subcutaneous swellings will be of single swelling. And the discharging sinuses, there will be serous discharge, and the granules will be are blackish in color. Blackish granules are observed in case of Eumycetoma. In case of Actinomycetoma, the triad will look like multiple swelling. So multiple painless subcutaneous swellings will be seen in Actinomycetoma, and there will be purulent discharge from the sinuses. Purulent discharge from sinuses, and the discharging sinuses will contain the whitish granule. And these are the difference between the both type of mycetomas. In Eumycetoma, the swelling will be Single swelling is present with serous discharge and blackish granule formation. In case of actinomycetoma, in case of actinomycetoma, there will be multiple swellings with purulent discharge and whitish granules. Now let's come to the lab diagnosis, that how will we diagnose mycetoma. So first we will do the specimen collection. Now specimen we can take the first the lesion should be, the lesion is clean with antiseptic. पहले तो हम जो स्किन पे लेजन है उसको एंटीसेप्टिक पे से क्लीन करेंगे. फिर बाई प्रेसिंग ऑन द पेरीफेरी वी विल कलेक्ट द ग्रेन्यूल्स. ग्रेन्यूल फॉर्मेशन तो होगा ही मैसेटोमा में, है ना. यूमाइसेटोमा है तो ब्लैक ग्रेन्यूल्स बनेंगे, एक्टिनोमाइसेटोमा है तो वाइटिश ग्रेन्यूल्स बनेंगे. अब उन डिस्चार्जिंग साइनसेस को हम प्रेस करेंगे बाई पेरीफेरी से प्रेस करके. तो बाई पेरीफेरी प्रेस करके, by peripheral pressing or with the help of lube we will collect the granules. ठीक है. उसके बाद we will do the direct examination of the granules. First we will wash the granules in normal saline, then we will crush the granules between the slides, and we will look at the slide in microscope, through the microscope. Now in case of suspected eumycetoma, the black granules will be formed, and these black granules, as we know that eumycetoma is a fungal type of mycetoma caused by fungal agents, and we can do the KOH mount, and while looking through the microscope we can see the thin septate hyphae of fungi. Thin septate hyphae of fungi will be observed in case of eumycetoma after observing the crushed black granules under the slide. In case of actinomycetoma, the white color granules, as we know that actinomycetoma is a bacterial mycetoma, it is caused by bacterial agents. Then we can do the gram staining. So while doing the gram staining and looking through the microscope, we can see the filamentous gram positive bacteria. Now we can perform the gram staining, or we can also do the modified acid fast stain. Now why we can do the modified acid fast staining in case of actinomycetoma? Because we know that the actinomycetoma is caused by bacterial agents, and among those bacterial agents one is Nocardia species, which is partially acid fast. So we can perform the modified acid fast staining also. Now we can also perform the histopathological staining. The histopathological staining in case of eumycetoma, the granulomatous reaction will occur, and this granulomatous reaction will be composed of palisade arrangement of hyphae. And in case of actinomycetoma, this granulomatous reaction will composed of filamentous bacteria at the margin. So these are the next slide of histopathological staining of eumycetoma. And This one we have of Actinomycetoma. So these two types of mycetoma can also cause the bony lesions, which can be of two types: osteosclerotic bony lesion, which is found in Eumycetoma, and osteolytic type of bony lesion is observed in case of actinomycetoma. Now we can also perform the culture. As we know that mycetoma, two types of mycetoma caused by fungal and bacterial agents. So we can do the both bacterial and fungal culture. In case of fungal culture, we can take the Sebos dextrose agar medium, and for bacterial culture, we can take the LJ medium, Lowenstein-Janssen medium. In case of uh, Eumycetoma, we will perform the fungal culture by using the Sebos dextrose agar medium, and for Actinomycetoma, the culture can be done on LJ medium, Lowenstein-Janssen medium. Now the treatment of mycetoma. The main primary treatment, the first line of treatment is mycetoma is surgical removal of mycetoma. After the surgery, we can start the medicines. After the surgery, we can start the medicines according to the type of mycetoma. As we know, the eumycetoma is a fungal, so we can use the antifungal agents. Antifungal agents like itraconazole and amphotericin B are used. Both of these are used in the treatment of eumycetoma. And actinomycetoma, as we know, it is caused by bacteria. So we can take the help of antibiotics for treating actinomycetoma. Now antibiotics are used. Combination of two antibiotics are used, which is known as Welsh regimen. Welsh regimen. Now this regimen is composed of amikacin plus quatrimoxazole for the treatment of actinomycetoma. So we have discussed about the mycetoma. Now let's do some multiple choice question for clearing our concept further. So the first MCQ is mycetoma is most commonly caused by. As we know, the mycetoma is of two types: eumycetoma and actinomycetoma. Eumycetoma is caused by fungus. Actinomycetoma is caused by bacteria. So mycetoma is caused by both fungus and bacteria. So in among these options, the option B is having the fungi and the actinomycetes. Actinomycetes are bacteria. Hence option second is correct, which is fungi and actinomycetes. Now let's come to the second MCQ. The classical triad of mycetoma includes all except. Now we know that in classical triad of mycetoma there are three symptoms are present. First, the painless subcutaneous swellings. Second, the discharging sinuses, and the third we have the granules. So option A, swelling is present. Option B, sinus formation, we see. Granule discharge also occur. Now hematuria is not observed, that is no blood in the urine is seen in case of mycetoma. So the option D is correct, that hematuria is not observed in mycetoma. Now the third MCQ, black granules in mycetoma are usually produced by. Now we know the black granules are produced with the characteristic features of eumycetoma. So the eumycetoma is caused by fungi. So the option C is correct, eumycetes. Now the next MCQ, the commonest site of mycetoma is. As we have discussed many times that the foot is the most common affected part in Mycetoma. Hence option B is correct. Madura fit is another name for, a very important question, that Madura fit is another name for. So Madura fit is another name for, as we know that it is another name for Mycetoma. Maduramycosis or Madura fit is another name of Mycetoma. So thank you everyone. If you like the content, then please like this video and keep on watching for further information and more informative videos. Thank you.